You feeling all right this morning? Yeah.
Revathi Pentapati was brought into Milton Keynes Hospital with COVID-19 a week ago. She was pregnant and her twin girls were delivered early while she was put into intensive care.
They were meant to come out today.
Oh, they should have been born today?
Yeah. And I was in intensive care for good 4 days. I don't know what happened with me. I was one of them that I didn't believe that there was COVID. But now when I suffered, I now know that there is COVID.
Revathi still hasn't seen her babies. She still hasn't held them.
Revathi, how do you feel now?
I feel great, but at the same time, I miss my babies. These are my first babies, and I haven't seen them. It's been a week.
By mid-afternoon, there were 220 COVID-19 patients in Milton Keynes Hospital, and the number will grow. They have no doubts about that. Christmas and New Year ending with a desperate attempt to breathe, or worse.
The only reason that we're allowed to film here today is because the NHS wants the public to know that this situation is now very serious. Here at Milton Keynes, on this ward, that bay is full, that bay is full, that bay is full. It's full down there. In fact, of the 14 medical wards, 10 of them are full. Not of other patients with other diseases. They are full of COVID patients.
This is Ward 18. They're on skeleton staff here. Many themselves are sick or isolating. Nurses are often working 60-hour shifts to cover, and they're dealing with patients who need significant care. And this isn't even the most seriously ill.
It's been tough on us all. I mean, I would say we look to each other for our own support. We try and keep each other going. But it can be tough. It can be quite tiring and draining, and generally all you do is you go home, rest and do what you can to recover in order to come back and do it all again the next day.
Many of the patients are noticeably younger than in the first wave. Zieko Savjev is 46. He came in 20 days ago and was in intensive care for 2 weeks.
I felt myself that I couldn't make it at some moment. But fortunately, thanks to all the care I got there, all the help from the doctors and the nurses, I got really, I made it. Yeah.
Did you think you weren't going to?
At some moment, I got scared. I admit that. I saw people around me that didn't make it at that time. And since I was there, I believe that I was the first one for that 10 days that got discharged successfully.
There are now nearly 27,000 COVID-19 patients in hospital in England, a new record high. Yet there are the skeptics, the conspiracy theorists, people who think this is no worse than a seasonal flu.
It makes me very angry, to be honest, because it isn't a normal flu season. We're not seeing flu. This is completely different. So we've got the normal winter pressures of people being very unwell with general medical conditions, plus COVID on top of it. And we're expanding our areas all the time. And everyone will be we're looking at our oxygen supplies, we're looking at our non-invasive ventilator machines, we're looking at our staffing levels, and can we cope, and how much more pressure can we cope with across medicine?
Yesterday, Milton Keynes Council declared a major incident because of a spike in community COVID cases that will inevitably have a knock-on effect at the hospital.
What we've seen certainly over the last 10 days is all of our concerns playing out in significant numbers of admissions to hospitals, and that's been a real challenge for us.
Are you right at the edge?
No, we're expecting it to get worse. We're expecting the numbers of patients in our hospital with COVID to go up. We're expecting significant pressures to be continued for the next couple of weeks, certainly.
But in the midst of all this gloom, something wonderfully joyful. A baby, or 2 of them to be precise.
Perfect. Oh, how's that?
Our new mother, Revathi, was finally allowed to see and, more importantly, to hold her twin girls. Even the oxygen mask couldn't disguise her happiness.
Hello.
And it really was a special moment for everybody who was watching that. Now, as I'm standing here, I've just been yelled at by a passerby who says it's all a conspiracy. Those wards are empty, that hospital's empty. It is not empty. It is fuller than ever. And what they had told us very specifically today is that they know that this is going to get worse before it gets better. And they, as I've said many times now, they're just begging the public to do the right thing and to stay at home.
Victoria McDonald. Well, that's the picture from one hospital, but the national figures reveal a wider picture. The Office of National Statistics now estimates 1 in 50 people in private households in England had coronavirus last week. And there are now more people in hospital with COVID than at the first peak of COVID infections in April last year. As of the 28th of December, 23,823 patients were in hospital with COVID, a nearly 20% increase on the previous week. To put this in perspective, on the 23rd of March, the first day of the first lockdown, 3,097 people were in hospital with COVID. On the 31st of October, when the second lockdown was announced by Boris Johnson, 12,291 people were in hospital with COVID. The current rate of increase means we could already be facing more than 28,000 patients in hospital with COVID now.
Well, we did ask the government if a minister would appear on the programme tonight, but no one was made available. I'm joined now by Alison Pritard, Doctor, Dean of the Faculty of Intensive Care Medicine, which speaks for critical care doctors nationwide. Dr. Pritard, we saw in Victoria's report that medics are exhausted. Can you paint a picture of how bad things are for intensive care staff?
Well, that video clip portrays it quite well. Staff across the board have been working hard since the beginning of last year, caring for patients, for everyone who will benefit from being in hospital, for being on intensive care. And to be honest, it's quite insulting to hear people say that COVID isn't real, as that passerby said to Victoria earlier. It's insulting to all the patients who are sick in hospitals. It's insulting to the families of all those patients who have died. And it's insulting to the staff who've worked hard to care for all those patients. It's really difficult, particularly for those areas in London and the South East who are really struggling with the critically ill and all the sick patients that are in medical wards, and for all those other hospitals who are starting to see a steady increase in the number of patients. This is real, and people really need to take notice and to do their best to make sure that transmissions stay low in the community.
With this vast number of COVID patients in NHS hospitals, can the NHS actually continue with its normal work, which is heavy enough?
Well, one of the things that we're desperately trying to do during the current wave is to try and maintain as much normal activity as possible. And the only way that we can do that is by reducing the number of patients with COVID being admitted into hospital, hence the reduction in community transmission and the restrictions. Obviously, those organisations that are under the highest pressure will have to postpone some of their normal activity, but each patient will be looked at as an individual to work out whose care can be postponed without it having any negative impact on their life, to make sure that we can care for patients who have COVID and also for patients that need urgent care, including those that have cancer, for patients who are pregnant and need care for themselves or their unborn baby, and for those that have chronic health conditions as well. So the NHS wants to be able to do everything, but unless we can limit the number of patients coming in with COVID, something has to give.
We're hearing that staff are having to ration oxygen. How bad are things?
It's not a case of rationing oxygen, because obviously anybody that needs oxygen will receive it. But some hospitals struggle to to deliver the amount of oxygen that is required due to the state of the delivery piping in the system. And that means it's the older hospitals where they're not up to delivering the massive quantities of oxygen. So it's not the oxygen supply that's delivered to the hospital, it's getting it from the storage tanks down to the wards. And so every hospital now knows the maximum amount of oxygen it can deliver at any one time. And therefore, if there is any risk of them reaching that capacity, then systems will be put in place either to transfer patients to other hospitals or to use equipment that limits or reduces any wastage in oxygen to make sure that it's used appropriately.
Well, now, people as young as 30 are being admitted into intensive care. Why has there been this rise in younger patients?
Well, I think certainly what we're seeing in intensive care is it's younger people coming in. So the average age of people coming into intensive care currently is 58, whereas it was just over 60 in the first wave. And if we look at the age range, we're having patients as young as 50 being admitted to intensive care. And obviously the patients who will come into hospital, it will be the older age group of the patients admitted who will end up in intensive care. So it's no surprise that we're seeing younger patients who are being admitted to hospital this time. And this will be because I suspect that older patients and the clinically vulnerable are isolating themselves to keep themselves protected. And it's the younger people, younger members of the community who are going out to work, who are more at risk of contracting COVID. And so that will be why, in my opinion, that it's the younger age range that are now being admitted into hospital. And that just shows that nobody is immune to this disease, that everybody needs to take the right precautions.
We heard somebody shouting at Victoria saying that this is all fake. What do you say to people who believe that this is in some way fake?
Well, you only need to look at the figures to see the number of patients who are getting COVID. They're not lies, that's the truth. We've seen the footage today, and we've seen footage throughout the pandemic of patients in hospital being very, very sick, being so sick that they get transferred to intensive care, and people dying. They're not false figures, they're real. And my colleagues around the country, whether they're doctors, nurses, allied health professions, they are working their socks off to try and make sure that patients are cared for in the best possible way. They're tired, they're exhausted. They don't want to be doing this, but they're doing it because that's what they're trained to do, and they don't want people to die. This isn't fake, it's real, and we all need to do our bit to make sure we get through this, because the light is at the end of the tunnel. We can see that we're almost there. We all have our part to play.
Dr. Alison Pittard, thank you very much indeed for joining us.